just really great to be here today. This is an exciting advance in our exciting plans to get vaccines into the arms of Manitobans as fast as we can, but we want to get it right first. And this super site in Brandon is going to be a key part of getting it right. We've got also some other great news for Brandon as we start getting the PCHs ready to go here in Brandon on Friday with injections, with vaccinations, and I know the residents there and all over Westman are really excited about that. Those projects will continue with enthusiasm over the next month. We hope to have everybody, our PCH residents, all safely vaccinated for the second time in not much more than a month, so that's exciting. We just had a great opportunity to learn from our gracious tour folks here, and I thank them very much. The preparatory work that's gone on, not just here in Westman and not just here at the centre, but right across the province. The team of getting up close to 1,000 people that's been working so diligently to get us ready for these vaccines deserves to be commended and thanked, and I thank them today. And we had the chance to see the 21 stations that are there and ready to go, the check-in areas, the seating arrangements, the flow management, the safety processes that are so important here as we protect Manitobans and help them to get protected against this deadly virus. It's a tribute, I think, to our frontline workers, but it's also a tribute, I think, to the volunteers that are coming forward and offering to take up positions on this team. We have the need for folks to come forward, and I'll do a little advertisement and ask people to do that and add their name to the list. We've got lots of preparation that's underway, and we want to be ready in case we do have the federal government give us more vaccines. We want to be ready to get those vaccines out as quickly as we can. So these are early days. By the end of the month, we'll only have 1% of Manitobans vaccinated by the vaccine availability schedule. And it's important that we learn through these early days how to do this properly and well and safely. It's also important for Manitobans to remember that the cavalry's not here yet. That this is not the time to let down our guard. We are starting to turn the COVID curve, unlike most other jurisdictions in the country. That's a tribute to Manitobans being disciplined and respectful of their own health and the health and well-being of others. And I thank Manitobans for doing that. That's critical. As we continue and we get more vaccines, it'll remain critical that all of us follow those protocols and procedures to protect each other through that phase. And I would remind Manitobans that their decisions to do their duty, to be responsible, are the reason that we are able to say that we are bending the COVID curve. But we're not there yet. And so it's important not to let down our guard. This is an exciting time. It's an optimistic time. I know the sense of relief that people have expressed as they've got their vaccine is palpable and real. And I know that for many of us that are going to be waiting for a while, we share that anticipation that we'll be able to be freed from the fears of COVID. And as a province, we look forward to having that same thing happen as we move forward, as we are able to start to reopen and start to give people their lives back. Doing this safely is really critical. So again, it's great to be here in my second hometown and say hi to the people I haven't seen much in the media for the last while, but to also say thanks again to our gracious hosts today for giving us a chance to share in this, what I know they say too is an exciting opportunity to make a real difference and to share in an historic event. So I have a new Minister of Health here I'd like to introduce. Her name is Heather Stefanson. She's no stranger to any of you who followed provincial politics for the last couple of years or more. And I'm tremendously proud of Heather and the work she's done in all her previous assignments. She's done an amazing job. And she has a job in front of her, but I know she's up to the task, and I know that she's a tremendous, accomplished contributor to our government team. And so I'm just really pleased to be, for my first time in Westman, with the Health Minister, to say welcome to Heather, and all the hard questions today go to the Health Minister.
Day 8, here we go.
Come on up, Heather.
No, thanks again, Premier. And just to say that I'm so honored and humbled to have been given this incredible opportunity to help in what is a very difficult time for so many Manitobans and so many people around the world. This is an unprecedented time for us, and I'm just so honored to be a part, along with our team of colleagues at the Manitoba Legislature, to really be a part of this vaccine rollout and really helping people along the way here to get them back into the routine of their lives, which is really what this vaccine is going to allow us to do, is to get back into some semblance of normalcy eventually. We're not there yet, obviously, and you have to remember, we can't remember the basics of washing your hands and wearing your mask and social distancing, obviously, right? We have to remain diligent with those things. But just honored, Premier, to be here with you today and Brandon as we roll out our super site here today. So with that, we open it up for questions, I guess. There you go.
Hello, Michelle.
Good afternoon. My first question is, I'd like you to explain why a data sharing agreement with Métis is not in place and why Métis are not receiving the same consideration and partnership opportunities as First Nations related to vaccines.
Well, I understand from the vaccine team that they've been getting ongoing input and providing ongoing input opportunities for Métis representatives to be part of that team. And I would also emphasize that initially, at least, our emphasis has been really to pay attention to the reconciliation principles that we Manitobans were a proud part of making come to be. We took our time, and we've taken some criticism for that, by being respectful and consultative with our First Nations representatives. And we want to continue to make sure that we do that. And so our vaccine rollout, for example, that went to Indigenous communities and northern communities was in large part designed with that partnership as its focus. And so we plan to continue to take that model forward as we go. Other provinces don't have as much of a percentage of the population or as much emphasis as we do on the recommendations of the TRC report, but we believe reconciliation approaches are important. In the short term, it takes a little longer because the initial planning and the initial discussion phase has to involve respectful exchanges, and that doesn't happen fast all the time. But in the longer term, as we roll out the other 99% of our vaccines, we'll be able to be more confident we're doing it with a respectful approach that does recognize Indigenous rights and Indigenous realities, as well as it does recognize the importance of the partnerships we have to make our plan work better.
How does that relate to the Métis?
I beg your pardon?
Well, the question was about the Métis.
Well, the Métis representatives have been at the table and have been part of this. But of course, Métis people live integrated for the most part with the rest of us in the province, as opposed to a lot of the northern Indigenous communities that do not. And so the considerations are not identical, as you would recognize.
How many people will work at this site? And does that mean how many shots, how many appointments per day?
So this is a moving target, right? Because we have I got a briefing note this morning. We're talking about this a little bit earlier, saying, well, it'll be over 100 and there are 67 hired. Well, there are more hired now and the number's changing. All I can say to you is be patient with the hiccups. We're creating an historic rollout of a vaccine in the middle of a pandemic. And I just want to say again, I'm asking the media to be understanding and charitable, okay? Because we're not going to fail to have hiccups, but we're not going to fail to address them. And the most important thing at this early stage, because this is a marathon, this is not a sprint, the most important thing isn't to get it fast. The most important thing is to get it right. And so that's what we're doing here. And so our personnel applications exceed in every category, exceed the positions that we have available, but the interview processes have to happen, and the clarification and the determination of roles and responsibilities and the various red tape has to happen. And it is. So we're excited to have this thing start next Monday. We're excited to have over 4,000 people vaccinated, I believe, in the first week. So that's really exciting. And I wouldn't want to lose sight of the fact that we're making progress in the midst of the indisputable hiccups that happen when you're trying to set up something for the first time.
Brian, you spoke spoke about some of the hiccups and that kind of thing. Have there been any setting up environment?
Less so, because we learned a lot, I think, from the initial project right at the convention center. What's exciting here, and what's exciting, I think, too, about the convention center, and I want to be clear on this. I didn't like the Prime Minister's comments. We spoke about it where he said, you know, the province aren't rolling these out fast enough. Well, I responded, and I shouldn't have responded perhaps in the way I did, but I said, well, you know, we're behind Israel, and we're behind two-thirds of the civilized world in terms of getting vaccines. That wasn't entirely fair, and so I want to say that. I want to say it's Team Canada time now. You know, and the federal government's working hard to get vaccines to us. I don't want Manitoba, and no premier wants their province to be the limiting factor that blocks getting more vaccines out. And so what I'm really excited about here at the Keystone Center, we can expand this place. As you know, there's available space. Ag Days isn't on right now. We've got tons of room, you know, and we've got great people. Westman is consistently among the most volunteer-oriented regions of our province. You guys know this, so we can get people coming forward, community-minded people, I mean, because they're going to be paid, you know. But I mean, people who want to come here and be part of this are innumerable. We have more applications than we have positions right now. What I would like to see, and I think every premier would agree, is we'd like to see more vaccines as soon as possible, because we want to get those vaccines to people. Because I know, and you know, the relief that people feel when they get that vaccine. It's real. These guys are going to see it starting on Monday. It's palpable. When people get that vaccine, and it's not just the first one, remember they have to get a second one, and we're following those guidelines. Some other provinces are choosing not to. They're extending the time till you get the second vaccine. We're following the company's recommendations. We're doing it, that's when I say we're doing it safely. We're following those recommendations for maximum effectiveness. And so we're going to continue to do that, and we're going to continue to expand our capacity as needed. We're ready to do that too.
So the Association of Regulated Nurses of Manitoba put a news release out earlier in the week saying the system is broken, and according to a survey of their nurses, they talked about a decline in patient care, and they list those. And they also talk about the mental health of nurses, how that's declining. And they noted that there is a potential that many may leave nursing altogether.
Mm-hmm.
Do you have a response to that?
I have two responses. First of all, this isn't a time for union campaigns. This is a time to work together. So let's be honest about it. Okay, this is a stressful time, and I have nothing but respect for our frontline workers, and especially our nurses working at risk to take care of people. This isn't the time for union agitation. This is not the time for that. It's not helpful. Okay? Secondly, we just created a new portfolio of mental health, specifically to work on mental health issues. And we've focused as a government on these issues, making available free to Manitobans, thousands of Manitobans, mental health services. So I take the concerns that nurses raise very, very seriously. But I also say this isn't the time to use, you know, COVID as an agitation opportunity.
Some school divisions would like their teachers to be the next one on the priority line to get the vaccine. What do you think about that?
Oh, c'est une bonne, is it a belle question or a bonne question? Belle, bonne question. We are going to be announcing some rollouts of rapid testing capacity to assist our teachers in being able to determine if they are at risk sooner, so they'll be able to spend more time in the classroom as opposed to waiting. That's an exciting opportunity, I think, for many of our educators, and something that many of our parents and students would also appreciate. More face time with their educator is a benefit to all our students. As far as the prioritization, that's a medical question. Our vaccination team has medical expertise in abundance, and they are going to determine the prioritizations as far as vaccine availability going forward. I have had numerous discussions on this topic because I know people are very anxious because they want to know when might I be able to get that vaccine in whatever occupational group. I've noticed already that some other countries and jurisdictions have rolled out their hypothetical strategies, and I would like to see us put those out for people to have a chance to discuss too. Many jurisdictions are using age as the principal criteria. That's one approach. But I'll leave this to the medical experts to determine when they move forward on that.
And just a clarification, you talked about 4,000 vaccines for next week, clarify?
Correct.
Only here?
Just here, 7-day period, yeah. Yeah. the commencement date Monday, and then going 7 days, 12 hours a day, 8:30 to 8:30, I understand, with opportunities for 12-hour shifts for people driving a long way, potentially, and for shorter shifts for those who are coming from a shorter distance, potentially available as well.
Are they already here?
Many are in there right now training, orienting,
No,
and
I mean the vaccines themselves. I was told that there's already...
it's a secret. We can't say. The police wouldn't, Brandon City Police would not want us to mention where those vaccines are right now.
Well, I understand that they're actually standing guard over the vaccines.
Well, that may well be, but I don't want to speak to security issues because I'll weaken the security effectiveness, I'm told, so.
Is this Pfizer? This is a Pfizer site.
The Modernas are being put to use immediately, though, in the seniors, some of the seniors' facilities where it's difficult to ship, of course, the Pfizer, and also the Modernas were more so for northern communities. I think Cross Lake has got it this week. I won't get into the communities. Sufficient to say that the northern communities are the recipients of most of the Moderna. We fought hard to get more vaccines. I lobbied the Prime Minister for weeks on this because we do have the highest Indigenous Métis population in the country of Canada. And many of our folks are at higher risk. There's higher positivity in the population. And this is proving sadly to be the case. 61% was the number yesterday of our hospitalizations that are Indigenous. So we need to prevent, as my mother, the teacher, used to say, put the fence around the top of the hill, not an ambulance at the bottom. You know, we're trying to prevent by getting to the hot spots as fast as we can. And so that's, more of ours has had to go. Our vaccines have had to go, not exclusively to Indigenous communities, but to rural and remote communities, because there are a number of hot spots there that we want to address right away. Well, why does this question, not to beat a dead horse, always follows the dead horse being beaten? Why is that?
Because I need a bit more clarification.
Well, I have clarified your question very much, I think. The voices of Métis people are being heard through the process. If you would like some written response, I'm sure the vaccination team would be happy to provide it to you. But there are significant efforts being made to work with our interest groups in our province, and in particular with the Indigenous and Métis people, to make sure that we're doing what's culturally appropriate, what works well for their population, what's acceptable, agreeable, sensitive to their needs. So that work is ongoing. Okay, tough question now for the Minister of Health, please.
Actually, I do have one.
Okay.
In terms
Day
of-
8. I'm just saying.
You may be aware there has been an outbreak at the Samaritan House here in the Safe and Warm Shelter. Are there plans to, like the Indigenous vaccination protocols, is there a move to try and look to people who are more maybe on the sidelines, like homeless people, that kind of thing, as part of an earlier vaccination schedule, maybe as opposed to, myself.
Right. Yeah, no, just, good question. And certainly in my previous role as Minister of Families, I had the opportunity to visit Samaritan House as well. And, we spent about $3.5 million preparing for COVID-19 in the homeless communities. And we spread that out, and Brandon was a recipient of that as well as Samaritan House. So we're very much aware. We were working mostly on the preventative side. Obviously, we know that this does spread. We know what the challenges are out there, and we have a really, really good, strong team here, as well as in Winnipeg and around, who are working tirelessly on this. I know there's someone within the Department of Families who is specifically earmarked for. She is responsible for the homeless community and ensuring that those needs are met. And so through that, we obviously work together as a team, and we'll ensure that as we get forward with the vaccine rollout, again, that will be, as the Premier said, determined by medical professionals as to the order of those that receive it. But we certainly work together as a team to ensure that we're looking after that homeless community as well.
Is this about giving the voice to the Métis people?
It's about small businesses.
Sure.
There have been small businesses that have had to shutter.
Yes.
Because of restrictions and how long they've lasted.
Yeah.
We're not out of the woods yet,
No.
I understand. Will you be looking at more alternatives, more for small businesses, so that we see less closing for good?
Well, sure, and along with small businesses, because I have to say I've been really mightily impressed by the diligence and respect for the rules that small business people have shown. But I've also been impressed by their willingness to adjust. And we are seeing many small businesses have adjusted their marketing models. For example, doing curbside, promoting a lot more online stuff, delivery. In spite of the tough times, we're seeing very resilient people pulling us forward. And that's the reputation of Manitobans, generally, but it is of our small business community as well. We've tried to come in with programs to bridge through. We know that we can't ever compensate all the people of Manitoba for all the hurt that's happened because of COVID, and I think everyone gets that. But we've designed some of the most, I think, constructive and effective small business support programs that are out there in the country. And they're not perfect, but they have helped now 10,000 plus businesses initially with some gap funding just to help them initially with a $6,000, not a loan, but a grant, meaning they keep it and they use it for what they wish, giving the business owner the latitude to use it. If they needed PPE, they can use the money for that. If they needed help with rent, money for that. We followed that up with summer employment programs to encourage people if they could get back going in the summer, and as you know, we had 0 cases for a number of weeks, very, very low cases for the first 7.5 months of COVID. So many small businesses did get back up and going again after the restrictions earlier in the year. And then with the bridge funding that we put in place, that's over $50,000 that we put out there in December. Yesterday announced $50 million, I should say. Small digit error there. $50 million additional yesterday. We've expanded that program to include home-based businesses. We have over, I think, 1,400 small businesses that are getting support. We've expanded it to include hotels, the hospitality industry, tourism-related, travel-related companies as well. So altogether, $250 million approximately so far. We expect it'll get up in terms of overall supports, like tax reductions too, closer to $400 million. That's the largest per capita supports in the country. And again, as a former small business owner, I know this is never enough. I know the hurt that this has caused. I understand being closed during the holiday busy season in December was very, very hard for a lot of firms. We all get that. And I say thank you to our small business folks for being so patient and so durable through this time. We'll get out of this, and when we do, I expect, and I'm backed up here by economic projections from RBC and the Toronto Dominion Bank in the last 3 weeks that say they expect Manitoba to lead the country in recovery. And that's because of our dynamic and diverse small business people, and their efforts are commendable. Thank you, everybody.
Thank you.
Nice job, Heather.